Today, we're going to talk about empowering change in addiction. We're going to focus on the stages of change model. This is a framework for understanding addiction recovery. This model is grounded in the idea that change is a process, not a single event. People move through a series of stages as they work towards sustained change, often cycling through these stages multiple times before achieving long-term success. It is widely used in addiction treatment to tailor interventions. So, what are the stages of change? The first is pre-contemplation. The second is contemplation. Next is preparation. The fourth is action. The fifth is maintenance. And the sixth is relapse. Let's start with pre-contemplation. So, in this stage, people are unaware of the problem. So, individuals are not yet considering change and may be resistant to acknowledging the problem. So, the goal is to increase awareness. So, someone who is resistant to the problem may not even know they have a problem or may become super defensive if you talk about their drinking or their drug use or whatever it is. So, how we bring awareness to the pre-contemplation stage is just start by pointing out the different consequences that they've experienced. So like, oh, drinking's not a problem for you. That makes sense. You got a DUI. Could that have been the result of drinking or was that something else? So you kind of begin by looking at what exactly the consequences have been, but you really want to focus on providing non-judgmental feedback, and focus on raising doubt about their current behaviors. People can become very, very defensive in this place of the stages of change. So it's important to come from a very non-judgmental place. Okay, that's pre-contemplation. Next is contemplation. So the pros and cons are being weighed. Individuals are considering change but are ambivalent. The goal is to resolve ambivalence and move toward preparation. So in this stage, it's normally like, oh, I think I have a problem, but I'm not really ready to whatever. You have to look at the ambivalence. What is it that they're not ready to do? Is it they're not ready to change whatever aspect of their life? They're not ready to do the inner work, whatever it means. You have to figure out what that ambivalence is to change. And then for support strategies, use motivational interviewing techniques, highlight benefits of change. So we're going to go over motivational interviewing today. So I'll talk to you a little bit about that. The next stage is preparation. So this is planning for action. So individuals are actively planning to take action. Small steps towards change may already be underway. The goal is to develop a detailed and actionable plan. This plan should be specific and time bound. So they're ready. They're ready to make a plan and they're already taking action. So at this point, what we would do is look at their life and try to figure out the gaps. Like, do they have housing or do they have transportation? Do they have their driver's license? And try to help them make a plan that will get them to working towards living a life of recovery and sobriety and whatever that means to them to integrate back into society. So some support strategies are assisting in setting SMART goals. I'm not going to go over what these are, but the basic idea behind these is specific, measurable, achievable, relevant, and time bound. So we like to set SMART goals for people because it's very, very specific and organized. And then also to provide practical resources and offer ongoing encouragement to stay motivated because there's a lot of work going on here and a lot of fear around this big of a change in their life and what it'll just look like. So the next is action. So these are active steps being taken to change behavior. There's a very high effort and commitment required. The goal is to reinforce and sustain actions. So once you have that plan, they're out there making that plan happen. And at this stage, it can really people can really come up against a lot of barriers to growth just because in the past maybe they've tried to get to this stage or they've gotten to this stage and they haven't seen a lot of change or it was too much. So having a lot of support, the support strategies are provide positive reinforcement and offer coping strategies and skill training because it's this part is very, very important for people to have the support on to keep going. Stage 5 is maintenance. So the idea behind this is that they're sustaining behavior changes over time. So one of the biggest keys to this is preventing relapse through self-awareness. And then the goal is to build resilience and long-term habits by creating a recovery lifestyle that fits for the person. So the idea behind this is if we have a relapse prevention plan or we are gaining our own self-awareness that relapse won't be as likely because we'll understand what our activation points that make us use drugs or drink and how we can cope with them. So the support strategies are to establish support networks, and that could be through 12-step or smart recovery or churches or things like rock climbing, whatever, wherever people can find a recovery group. Maybe it's a book club or something like that, depending on the person, what works for the person, right? And then we really want to reinforce self-efficacy. So relapse is a common detour. I don't like to say, I normally tell people relapse is part of recovery, but it doesn't have to be part of your recovery. So the whole idea behind this is that we don't want to shame people for relapsing because really it's an opportunity to learn. So, like, what was it that caused me to relapse? What activated me? And gaining a deeper understanding and insight into self and purpose is the biggest gift of relapse. And so, if we're stuck in shame, people really get stuck in that place and it makes it really difficult for them to come back. So, I always just tell them relapse is part of recovery for many, but it doesn't have to be part of your recovery. Because lots of clients have also told me that when I say relapse is part of recovery, that it makes them feel like they should relapse because it's part of recovery and it's kind of like an out. So that's what I say. If people do relapse, then we want them to re-enter the cycle with renewed strategies. So what could you do differently this time to make sure that you can stay in recovery? And then just support strategies are kind of what I already talked about, but normalize relapse as a learning step, reassess and adapt the plan. So the skill we're going to talk about today is motivational interviewing. I actually use this with everyone in my life, whether it's my family members or my clients or whoever it is, maybe the someone at who's selling me something. I don't know. But the idea is motivational interviewing is a collaborative, person-centered counseling style, and it's designed to strengthen a person's motivation and commitment to change. So it really focuses on listening and eliciting change talk. So why use motivational interviewing in addiction treatment? Because it helps clients explore and resolve ambivalence, empowers individuals to take ownership of their change process, and it increases engagement and reduces resistance to treatment. And I'm going to tell you how. So the core principles of motivational interviewing are that you will express empathy, and you'll do that by you'll build a rapport by understanding without judgment. So you just listen from a non-biased, non-judgmental place, and you support. So you validate, and then you want to develop discrepancy. So highlight the gap between current behavior and personal goals. So what is it? Like, what's the behavior that they're having and their goal, right? And I'll go deeper into that. And then you roll with resistance. So you do not argue. You don't say, no, you're wrong. You don't say, let me tell you what's going on. The real big thing is that you reframe resistance as ambivalence And so, oh, it sounds to me like you're not ready to take that step yet. Instead of, no, you're wrong. And then support self efficacy. So reinforce the client's ability to change. You can do this. You can do this. So you're just validating. So the ORS framework, these are the tools that you use. So it's open-ended questions. So open-ended questions encourage deep reflection. So instead of saying, did you buy drugs? Which is a yes or no question, I might say, what was going on with you that day? What did you do that day? What what activities were you doing? What emotions were you feeling? And then through those open-ended questions, you can kind of steer the conversation to get the answer you need. And I'll go deeper into that. So you want to use affirmations. The A in the ORS framework is affirmation. So you reinforce strengths and efforts. So you might hear something like, I got in a big fight with my partner and I just needed to go use drugs because I was feeling so sad. And then something you would say is, well, great insight into what caused you to feel sad. That's amazing. Not a lot of people have insight into that. And you realize that that fight caused you to use drugs. Good work. So you're affirming what they're going through. Reflective listening. So this is a big one for a lot of people really like to know that you heard them, and it really actually checks your understanding too. So show understanding by summarizing feelings and thoughts. So what I just did was actually reflective listening also, but I would say back to that person, it sounds to me like you have really good understanding of your own emotions and your things that activate you. You got in a fight with your significant other and you ended up feeling really, really upset. So you went to use. And I just said exactly what they said back to them. And that's reflective listening. So sometimes when people hear what they say back, it allows them to really reflect on what they said. And it allows you to make sure that you understand what they said. Because they could say, no, I didn't say that getting in the fight was what caused me to feel upset. I said crashing my car. And maybe you missed this whole story that they didn't tell you. Um, so then you summarize, recap key points to reinforce progress. So then this is where you kind of come in and you look at what the whole story is. What is the whole story? Oh, so you got in an argument with your significant other, and then you got in the car and you got in the car accident, and that caused you to get really upset. So that's what caused you to use. And you kind of summarize the key points of what you talked about and the insight and any positive affirmations and any open-ended questions that you need to talk about. Okay, so that's the basic idea of motivational interviewing. So we're going to watch a video that kind of shows you how it works. Here you go.
Alas, it would be impossible for me to teach you all the skills inherent to motivational interviewing in this brief video. Instead, I will focus on a few essential components of this approach that you can immediately use in your next patient encounter. To demonstrate these skills, I will use a conversation around smoking as an example, since this is sure to be the most common substance you encounter in clinical practice. But remember that you can use this approach to discourage any unhealthy substance use, or to promote any other healthy behaviors, such as weight loss strategies, exercise routines, or adherence to medications. First, if you want to start a conversation with your patient about their substance use, ask permission. Patients with substance use disorders are accustomed to being criticized, ridiculed, judged, and berated for their behavior. So, by asking permission, you've already clued in your patient that this is going to be a different sort of encounter. So, Ms. Roberts, is it okay if we chat a bit more about your smoking? Next, ask your patient what they like about smoking. Patients only engage in addictive behaviors when those behaviors do something for them. Perhaps smoking helps the patient to relax. Perhaps they just like the way it makes them feel. Maybe it's just something to do during a break at work. Either way, providing your patient an opportunity to explain why they continue to do what they do tells the patient that you care about their perspective, and ultimately, it builds rapport. Hey, if your patient replies, I don't like anything about smoking, well, you've just found something that the two of you agree on. Next, ask the patient what they don't like about smoking. Some patients may have a litany of things that they don't like about smoking, such as the smell, the cost, the health concerns, and the nagging from their significant other. You'll want to use reflective listening here, with plenty of mm-hms and I see, and tell me more about that, as well as just simple silent attention. This ensures your patient has the opportunity to fully flesh out the negative associations they have with smoking in more detail. Of course, some patients may have very little to say here. This is your opportunity to gently ply your patient for the potential negatives they may not have thought of. Think about the potential complications of smoking. You might ask about any issues with chronic bronchitis or decreased exercise tolerance. You can also explore issues with hypertension, gastroesophageal reflux disease, and erectile dysfunction. Other questions to ask to coax the negative associations out of your patient include, do you have any family history of cancer? Are there conflicts at home regarding your ongoing substance use? How much do you spend each month on your habit? All these questions should be asked with a genuine curiosity and a non-judgmental attitude, where you are simply gathering data to be used in the next step. Finally, ask your patient if they have ever tried to quit or cut back in the past. If they say yes, ask why. What led them to quit in the past? This detail may be the most important bit of information you obtain, since you know it was important enough at one time to have led them to make a quit attempt. Okay, now, armed with all that information, home in on the ambivalence. On the one hand, it sounds like smoking cigarettes really helps you to relax at night. But on the other hand, it sounds like smoking is costing you about $250 a month. You don't like the smell, and you're worried about this nagging cough you've had for the past several months. Seems like you are conflicted about your smoking. This statement draws attention to the patient's ambivalence and conveys to the patient a sense of compassion and an acknowledgement that making change is hard. After pausing to allow the patient to reflect on their ambivalence, move on to the question of how ready they are to quit. Ask, on a scale of 1 to 10, with 1 being you want to continue smoking exactly as you are, and 10 being you want to quit smoking right at this moment, where would you say you are along this scale? If the patient responds with any number between 2 and 10, your response will simply be, okay, you picked a 4. Why didn't you pick 2 or 3? By asking the question in this way, you're asking the patient to repeat the factors that are motivating them to contemplate change. In contrast to that paternalistic approach we described in the prior lesson, in which a clinician might say, stop doing that, shape up, or you need to quit, inevitably leading the patient to defend the status quo. With this new approach, you have now put the patient in the position of defending change. A patient who can defend change is clearly in the contemplation stage, so your next steps would be to try to steer them into the preparation stage by presenting a menu of options and coming up with a plan together. Going back to the readiness scale, if the patient responds with a 1, then they are in the pre-contemplation phase. All you need to do is respond with a statement that affirms their autonomy, such as, you are the driver of your own ship, and I appreciate you letting me hear more about your perspective. It's crucial that the conversation ends with empathy and support, even if it may appear that the patient has not budged from the pre-contemplation stage. Sometimes, a brief motivational interview is merely the planting of a seed that might bear fruit at a later time. Be sure to ask your patient if it would be okay to bring up the topic again at a later visit. And that's motivational interviewing in a nutshell. Regardless of the outcome of your first efforts, the crucial components here are that you, as the clinician, do more listening than preaching, do more empathizing than judging, and do more promoting patient autonomy than dictating. Try it. It works.
So I hope you liked this video. Absolutely make sure to check out the course.
Okay, so that video really went over what it looks like to use motivational interviewing and the different steps. So now we're going to look at what it looks like to use motivational interviewing in a crisis scenario. So we're going to talk about Alex. So the mobile crisis unit is dispatched to assist Alex, a 45-year-old man experiencing escalating health issues due to alcohol dependency. Alex has been drinking heavily for years, but recently lost his job due to absenteeism. His partner, Jamie, reports that Alex has been irritable, withdrawn, and resistant to any discussions about getting help. Upon arrival, Alex admits he knows his drinking is a problem, but insists, "It's too late for me to change. I've tried before and nothing works." Alex's partner is frustrated, saying, "He doesn't even try anymore." So here's our objectives for the crisis team. Goal 1, use motivational interviewing to engage Alex without judgment and explore his ambivalence about change. Goal 2, identify which stage of the stages of change model Alex is currently in. And goal 3, support Alex in moving toward the next stage of change and help Jamie provide constructive support. Okay, so let's put this right here. Okay. Engaging through empathy. So this is a motivational interviewing principle, express empathy. So here's the action. The team listens actively and validates Alex's feelings to build trust. Team member might say, "It sounds like you've been dealing with a lot and it's understandable to feel overwhelmed by the thought of change. I appreciate you being honest with us." Outcome. Alex nods, indicating he feels heard and begins to open up about his struggles. So let's do the next principle, MI principle, develop discrepancy by exploring his ambivalence. The team gently highlights the gap between Alex's current behavior and his personal goals. The team member might say, "You mentioned feeling like it's too late, but it sounds like losing your job has been hard for you. What would life look like if drinking wasn't holding you back?" So the outcome, because he's compared the two, right? He's shown the discrepancy. Alex admits he misses his job and wants to regain stability, revealing his motivation for change. So once you have the motivation for change, right, then you start to identify the stage of change he's in. So we do an assessment, and from what we've heard so far, the team determines Alex is in the contemplation stage, where he recognizes the problem but feels uncertain about taking action. So he sees it, but it's almost as if he doesn't have the self-efficacy to actually do it, right? So the action that we'd use is reflective listening to deepen his self-awareness. So the team member says, "It sounds like you want things to be different, but you're unsure if change is possible." That's a tough place to be. So the outcome would be Alex acknowledges his fear of failure, but begins considering small steps toward improvement. So supporting progress toward preparation. This is the MI principle, support self-efficacy. So the action is the team helps Alex identify small, achievable steps to build confidence. A team member might say, "What's one thing you think you could do this week to feel more in control?" And Alex suggests limiting his drinking to specific times and agrees to explore local support groups. So the outcome would be Alex feels a sense of agency and agrees to take the first step. So the big outcome would be that Alex agrees to attend a local AA meeting and schedules a follow-up with a counselor. He expresses hope for change, but asks for time to process his next steps. Jamie feels more equipped to support Alex without increasing tension. So this is how you would use motivational interviewing to help someone that's really struggling with where they're at in the stages of change model. So let's talk about a debrief. How did motivational interviewing help Alex engage in the conversation about change? So we expressed empathy, then we explored his ambivalence, and then we talked about small steps that he could take to build his self-efficacy. What stage of change was Alex in, and how did the team support his transition? Well, Alex was in the contemplation stage because he realized he had a problem. He just wasn't ready to start making any steps towards changing it. The team encouraged him to move toward the preparation stage by setting achievable goals, right? How did involving Jamie enhance the intervention? So, Jamie's involvement provided Alex with additional support and reinforced the team's efforts to foster change collaboratively. All right, well, that is how you would use MI. So the key points of today's training is the stages of change model. So behavior change is a gradual process with distinct stages, sorry. Relapse is a natural part of recovery. Relapse isn't failure, it's an opportunity to learn and adjust your strategies. We talked about motivational interviewing, and this is a client-centered approach, fostering behavior change through empathy, identifying discrepancies between behavior and goals, and supporting self-efficacy. And then we talked about the ORS, communication skills, and MI. So those were open-ended questions. Remember, we don't want yes or no answers. Affirmations, so that's like stating positives about what they're doing, validating them. Reflective listening could be anything from tell me more, to going back and saying what they already told you. And then summaries, and summaries are taking the whole story and saying it back. Okay, thank you.